Corewell Health. We're going to be talking with her over the next couple of minutes. And again, this segment you can watch on either the Hot Country Hits Facebook page or the WMOM Facebook page. We're also streaming it on our YouTube channel. And you can listen to it on your smart devices like your Amazon Alexa, your Google Home, and of course at hotcountryhits.com, WMOM.FM, and your radio frequencies at 99.9 and 102.7. So, Abby, I hope all of that doesn't make you nervous this morning. How you doing this morning?
I'm doing well. How are you?
Good. Let's put your microphone, turn on your microphone there, and say hi to you. And I love your story because you've been with Corewell Health for how long now?
Just about 6 years.
Okay, and congratulations, by the way, and thanks for all that you do. Mostly or all the time in the ER?
Yes, all the time in the ER.
Okay,
So.
and so over the next couple of minutes as we chat with Abby, you're a BSN RN and the trauma program coordinator here at Corewell Health Ludington Hospital. And I think your story is pretty incredible because the idea of the trauma project that we're going to be talking about is pretty awesome for sure. Mm-hmm. But this is a great example of how an employee can come up in the ranks in any industry, obviously healthcare as well. But sometimes, Abby, as somebody from the outside, I always hear about, and not necessarily Corewell, but somebody was hired from out of market to come into the area and be in charge of this area or that area. That didn't happen in your case. You strove to become, to go higher in the ranks there at Corewell Health, right?
Yeah. I kind of made my roots here in Ludington, and I started out in Muskegon for a couple years in their ER, but I was commuting from Ludington, and, I wanted to make my home here in Ludington, so found a job here in the ER and been here for the past 6 years, and just kind of went where the wind took me, and that was with the trauma program. So.
Can you say out loud, I mean, maybe some of your friends are still in Muskegon, I understand that, but can you say that Ludington is better than Muskegon? Would you say that?
I love Ludington.
Okay, thanks. Appreciate it. Okay, that's good. Well, it's the first time you've been on the air with us, so let's chat about this, the little bit of history here, the trauma program at Corewell Health and the trauma project for those, and I was shocked by this statistic that I think 85% of and I want to make sure I get it right. Naturally, 85% of falls occur in adults 65 and older, which we think about that, right? But a lot of the traumas that come in are falls that your team has to deal with, right?
That's correct. Yeah. And specifically in Ludington, we see it ranges from 70 to 80% of our traumas are sustained from falls. So, it's a really staggering number that we see, and something that we really wanted to do something about. So
absolutely. And over the next few minutes, we're going to be chatting about that. And is it kind of the observation? I mean, this is an opportunity for you to, when you were in Muskegon versus Ludington, do you just observe, not statistically, but just from an observation standpoint, that we do have an older demographic here that are coming in through the hospital doors based on the trauma experience that you see?
Yeah, I mean, I think we definitely see primarily an older population here, but I think across the board there are older populations that are falling across the board. So
yeah, and Ludington, right here at Corewell Health, we have the level 4 trauma facility. And for people like me, I'm clueless. Like, what does level 4 mean? Do you mind kind of walking us through that, if you don't mind?
Yeah, so we're a designated trauma facility. What it means to be designated is it just creates more opportunity for us to focus on process and performance improvement, just increase opportunity for advanced training, and it's also associated with decreased death and injury for patients incoming, just because of the resources that we're given as a designated trauma facility. It is also a tiered system, so we are the fourth, just because of our resources that we have. So, is it?
I know this makes sound like a weird question, but I'm going to ask it anyway because if you don't know me already, I'm a little weird. Janelle will confirm that.
Yes.
I believe. But in regards to how much of a reality is it in the trauma from what we see on TV and in these movies and such? Is it the same kind of chaos and everything else? Because we always look at our healthcare workers and we try to put them up on this pedestal because they work long hours from what we know and what we hear. They obviously were one of the the categories, or whatever you want to call it, that drove through the COVID years and without stopping. I mean, without taking that break, and were strained. How much of a difference is it from what we see on TV and everything else to what it really is?
Yeah, I mean, obviously things are a little more
exaggerated,
a little more exaggerated on TV, but I think that it is a lot more controlled chaos in the reality of it. I mean, we are a team, we're a family at the end of the day. And so when we come together in those times of trauma and times of stress, we really band together and come together to try to achieve a common goal. So, and that's to take care of the patient. So
absolutely. And we hope that the healthcare workers are starting to, feel less stressed now that, I mean, it's not gone. I mean, we see our spikes, right, from what we hear at the schools and people getting sick. I was sick over the last couple of days, fighting through it. Not COVID, thank goodness. But the healthcare workers still are our first line defense, and so we thank you for all that you do. And I hope, as we talk about trauma, especially because that's where that's where they're entering, right? They're coming into the hospital, and it's the worst moment for their life at that time. Can we say that the healthcare workers are seeing appreciation and feeling appreciation from the community at this point? Do they feel that?
Yeah, I think it's always a great feeling when we get outreach from anyone that comes to us to say thank you after they've received care. I mean, we have cards hanging up in our break rooms, and people will bring in treats every once in a while, and someone brought in flowers for us. So just those little things that make us feel appreciated and validated. It makes us feel really good.
All right.
You still have that Daisy Award thing, right?
Yeah, we still have the Daisy Award program going on. So you'll see staff members wearing their daisies on their badges very proudly. So
very cool. Yeah. I don't know, what is that?
They have it in like the ER room. I don't know if it's any other rooms, but like the ER, you can, if you really like your nurse or if you notice them going like above and beyond, I think you scan a code and you can like elect your nurses.
Yeah, yep. You can scan a little QR code and nominate your nurse, and it goes to like a council, and they give you a Daisy badge, and then it goes to like an even higher up council, and they'll give you like one person in the hospital will get the big Daisy Award. So
that's pretty cool. I had no idea.
Yeah.
We're learning a lot today. And we do want to be able to thank our healthcare workers. So a big shout out to them. I know we just got the invite, I think it was just yesterday, from President of Corewell Health Ludington, Drew Dostal, sent out about the cancer center. That's going to be opening up, or the introduction and the event January 11th. So we're looking forward to that, and we'll be talking about that more. But right now we're talking with Abbey Dawe. Abbey, Trauma Program Coordinator for Corewell Health Ludington Hospital. And so let's go back to for anybody that doesn't understand what the trauma facility here in Ludington does or is, because we know what the ER is, right, in the ED, emergency department. But the trauma is a part of that. But what's the difference? Do you mind kind of separating that out for us a little bit?
Yeah, I mean, we're all in one. It's just that trauma separates a little bit in that we specifically look at all of our trauma cases very carefully. A part of our program is looking at process specifically, just to see what we can improve upon. And that's one of the biggest parts of my job is looking at those cases specifically to see if there's anything we can improve upon, any feedback that we can take back to the team. And that's one of the benefits of becoming a designated trauma facility and using some of those tools and resources from the state of Michigan and some of the other counterparts of Corewell Health that are also designated facilities.
And so that observation led you to this fall project and I'm talking about the season. I'm talking about the observation of these individuals coming through the door, sometimes on stretchers, sometimes walking on the door, sometimes in wheelchairs, and et cetera. And you observed over and over and over again that there needed to be something additional here for these patients. So walk us through that history of why you decided, how you decided, and what it took to get to that next step. Do you mind doing that for us?
Sure. Yeah. So we look at our data very carefully. We have people in positions that specifically look at our data and how our mechanisms of injury occur in our trauma patients. And so we saw that falls were amongst the largest number of mechanism of injury. And like I said before, 70 to 80% seem to be the number that we were falling in. No pun intended.
No, it's all right.
And so, we saw that this was a huge opportunity to help do something for our community. And part of the job in being this trauma program coordinator is also being the injury prevention specialist and promoting things in our community that we can, that we've identified within the trauma program to help facilitate safer and safer environments and put out resources that are going to prevent injury.
And so you came up with this kit that will be launching in January, which right away sounds kind of cool, that you were able to get from the thought process, how do we do this, how can we achieve this? Because I'll admit it, I mean, any hospital, small or large, there's so many restrictions, right? And there's so many, I would call them hurdles for anything that is different than the status quo, right? And did you find that could have been a challenge right away or not?
Well, I got this money from the state of Michigan, and so I found that I had a little bit more leniency in what I could do with this project. And so I was able to get a little more creative, which was really nice.
It's very cool.
So, yeah.
And to have Corewell Health embracing it and saying, okay, let's move this direction. So these are kits that, what would you say, can help people if they fall or help prevent them from falling? Do you mind just take us through that?
So these kits will help prevent falls. I can kind of go through some of the items that are in the kit. So the kit contains non-slip socks, rug corner grips, so that you can secure your rug securely. They also have strips that you can put down in your bathroom to help create more grip in your bathtubs, because that's where we see a lot of falls occur. They also contain night lights just to help illuminate dark hallways, because we know that grandma's on diuretics or water pills that cause her to get up in the middle of the night, and falls occur a lot of times at night. So. And then we also have a lot of information as far as pamphlets that'll be in the kits from the CDC. Their STEADY program has a lot of really great information. So we did include some of those as well. So that's precisely what's in the kits. And then we have some other resources too.
Okay. Take us through, and it wasn't just you, right? Did you have a team? Did you have input from other of your healthcare workers? What did that look like?
Yeah, so I can't say that I was the lone person that came up with this idea. I was actually able to talk with some of the other trauma coordinators from other Corewell sites that have implemented some similar ideas, each of us implementing our own items in our kits, but a lot of idea sharing amongst us. So that was really nice.
All right, that's good to hear. If you're just joining us, we're talking with Abbey Dawe, BSN RN Trauma Program Coordinator here at Corewell Health Ludington Hospital. And we're talking about the trauma, the fall kits that will have multiple items. And one of those items you mentioned was the socks, by the way, if you go to the hospital. Are those the socks you get from the hospital? Like, those are fantastic, by the way.
Everyone loves those socks.
Yeah, for sure. But they come in handy, and they're hopefully, after that first month, 2 months, 6 months, year, couple years, you're going to see the impact that this fall kit will have. What's your expectations? What's your hope, I guess, in regards to this?
Yeah, my hope is that we start seeing hopefully less falls, first of all, but hopefully just more education and awareness in the community. I think that's the biggest thing. And just knowing that there are really good resources out there provided by the CDC, provided by the National Council on Aging. If family members are aware of some of these resources that are available, then they can help really implement and drive these ideas home, that we can help fall-proof homes and provide education to those that are really at risk.
So I have a question. How do they say they're interested in the fall kit? How do they get a hold of the hospital, or how do they get them?
So we're working on means of distribution. I've been in contact with quite a few people that are going to help me. We'll be distributing them through the ED. As well as our inpatient floors. And then our inpatient physical therapy team is also going to be helping us. And then we also have a community worker that's going to be helping identify those that would be in need. And then we'll also be placing flyers in participating clinics around the area. So
because we want to get the word out that they're available. So the question that the elephant in the room that we haven't got to is there going to be a cost behind them? If there's any charge? What are we looking at?
Nope, these will be absolutely free. We want these to be available to anyone that needs these. So
that's pretty cool. Yeah. And that grant has helped that the state of Michigan money. Can it sustain? Can you? And again, I don't want to look too much in the future, because the goal was to get the kits out there, and you're doing that in the month of January. Have you looked at the long term for it? Is it going to be something that could be established year after year? We can't always know that money is going to be there, the next time we go back there. But have you thought about the sustainability of that?
Yeah, that's a great question. We did implement an audit tool just so that we can get feedback on each of these kits that we're distributing, so we can see who's exactly getting the kits, not names or anything like that, but what kind of patients that are receiving these kits, and what they're most at risk for. And then that way, when we get the data back, looking at our specific trauma data, if we're seeing those numbers come down, we can then prove to whoever might be funding this project next, whether it be the state of Michigan or another body, that we can show proof that this project does work and impact our community.
That's pretty cool. Mitch Foster, city manager of Ludington, he actually had a comment just a few moments ago on our Facebook page that said, we're glad to have Abbey here in the community. So it's
thank you, Mitch.
good thing for you. And we see it in this project, and so we're excited about it. And you might be even thinking about other projects that you want to implement in the future, and we would love to have you back on the air to talk about that. Right now, you're looking at a January launch. You hope to have it in the emergency department. You've also tried to team up with Life EMS as a distribution partner, and other ways to get those out, right? Do you think it'll all come together?
Yeah, I think it will. Life EMS has been monumental in helping put this whole project together. We had a fall kit build and put together all 300 of these kits together. Wow. Yeah. They help provide the space. Jim Harima has been really, really big help in providing some education to staff and putting this out to his team. So big shout out to him.
Very cool. Well, before we wrap up, is there anything that we forgot to talk about in regards to this? We know that most falls happen that's 65 plus. So from a community standpoint, we need to look out for our seniors in the area, our older demographic there. This isn't just, I would assume, for just that older demographic. Anybody could have falls based on any condition in their life. And so you're making sure that these are available for everybody.
Correct. Yeah. They are available to anyone. I mean, medications can obviously affect your ability to fall. So it's not just for that 65 and older age group. It's anyone that's identified as a high risk group. We also, in addition to the fall kits, a large portion of the funds went towards purchasing walkers and toilet rails to go around toilets to help you get up and down from the toilet, which requires no installation whatsoever. So that's a bonus. And then we also purchased some ice cleats for the winter time because we know a lot of falls come in from slipping on the driveway. So those are some additional items that will be available for anyone that wants them.
All right. I would assume that information in regards to how people can acquire those, that'll start being released there January, late this month into January.
Correct.
All right.
Yep.
So we'll have more updates in regards to that as we get closer right here on Mom FM and Hot Country Hits. Abby, anything we missed talking about in regards to this program this morning?
No, I think that wraps it up.
Yeah. Well. Thank you. That's a pretty cool initiative that you and your team put together, and we'll continue to promote it until hopefully all 300 kits are gone and in the hands of people that need them, and it will help save injuries and save lives for sure.
Yeah. No, thank you so much for giving me the space to talk about it. I appreciate it.
Absolutely. It is 8:55 here on 102.7 Mom FM and Hot Country Hits 99.9. If you missed any part of this segment, you can watch it in its entirety on our Facebook pages, Hot Country Hits Facebook page, the Mom FM Facebook page, and of course our YouTube channel. And make sure that you spread the word about it so that those kits can get into those hands of those individuals that do need them.